Welcome to the NursiConnect podcast. My name is Ava. I'm the chief executive and founder of the remote nurse staffing agency, NursiConnect. And on this podcast, we talk about all things remote nursing. And today, we're going to get into utilization management. We're going to talk about how to get into it, what is it, and how do you even do it remotely as a nurse. Today, we have a very special guest on today, and I'm going to let the guest introduce herself. Welcome, Andrea.
Hi, I'm Andrea Brown. How are you?
Good. Thank you so much for being on the show.
Okay. You're welcome. Thanks for having me.
Yes. Let's get right into it. So can you tell us a little bit about your nursing journey and how you even made the transition into remote work?
Yes, I've been a nurse for 30 years. I've done nursing home, long-term acute care, and then I've done home care. And just happenstance, I was doing home care, and a Medicare administrative company that do Medicare contracts contacted me and wanted me to do medical review for them. And that's how I got started.
So you're like, this is contract work for you?
The job that I have now, I work for United Healthcare. And so that's a permanent job, but I have worked so many different contracts through different agencies and travel. I've also traveled and done it also.
That is so cool. You said you've been a nurse for 30 years. Thank you. Thank you so much. Because
You're welcome.
It's kind of hard to stay. Well, the way it is now, it's hard for a nurse to stay in the profession up to 30 years. So when you see a nurse that's been a nurse for 30 years,
yes.
you just give them a round of applause because thank you.
Yes. It took a minute. I was a nurse. I was a floor nurse for 11 years, and then I kind of got burnt out, and then I kind of happenstance into utilization review and medical review. And so since I've been in that, I pretty much love it.
Oh, I bet you do. What type of floor nursing did you do before you made the transition?
I've done med-surg, like I said, nursing home and LTACs. And so I kind of got pretty burnt in it. I've done hospice. I was a hospice case manager, and I also was home care case manager.
Okay, so yeah, you got a good extensive background, and we love it. So yes. Can you kind of give us like a definition of what utilization management is and how it relates to nursing?
Yes, utilization review is basically the process of evaluating the medical necessity of a hospital stay or medical services. And so it's communication between the hospital and the payer or insurance to see if the patient is medically necessary for the treatment that they're getting.
Okay.
And there's three types. There's three different types of utilization review. One is prospective review, which is done before services are rendered, like prior authorization, like if a patient have a surgery that they need to schedule or back surgery. A lot of those are prior authorization, so that would be prospective review. And then you have concurrent review, which is what I do mostly. It's like head in the bed. The patient is in the hospital getting treatment, and then we do reviews every other day for that patient from admission to discharge. And then we have retrospective review, which a patient has left the hospital, and then the hospital sends the payer the information for the to check to see if the patient is medically necessary to have the treatment that they have.
Yeah, I usually, because I'm still kind of like part of the bedside team, prior authorization, I usually see it a lot for our patients that are going from the hospital to the nursing home. Is that the same thing or is that different?
That could be the same thing, but it's still under concurrent review, because once the patient get discharged to the hospital, we still, even if they go to a SNF, they call it, skilled nursing facility, we still follow them until they discharge.
Okay, I got you. So can you kind of talk about, since we got the definition out the way, can you kind of talk about what a typical day looks like for you? What your schedule is?
I work from 6:30 to 3:30, but once I come on, I log in, and we have these different platforms that you go on. The one platform that I use is called a set. That brings up the member and all their information. And then we could go in there and chart in their information. And Once I get in there, then I can also go into what they call MCG or Milliman Care Guidelines. That's the evidence-based practice on how you're going to make the decision to see if this is medically necessary. It's a MCG. You go in, you look at the patient's symptoms, like if a patient come in with end-stage COPD and they had an exacerbation, you get their oxygen level and you go in to MCG. And when you pull up COPD, it'll bring up all the symptoms. And that's how you make it meet, is going back and forth from the patient record to the evidence-based criteria. And that's how you match it. If it don't match, it's observation or we don't approve it, which we have to send it to the medical director. If it meets, we approve and keep going.
Okay, so you're doing that all day long for different types of diseases, or is there a certain population you serve?
No, it's all different types of diseases, heart attacks, COPD, trauma injuries, anything that they have to go to the hospital for that's under that insurance. If they're under our insurance company, we have to do a medical review to make sure it's medically necessary for them to be seen.
Okay, got you. So you have to be familiar with the disease process. You have to be familiar with the testing that goes along to confirm diagnosis, things
Right.
like that, right? Yeah.
Right. And then once it's pretty, when you use Milliman Care Guidelines, it's pretty easy. All you're doing is matching it with the patient's symptoms, and you click the little buttons and it'll tell you that it matched. It'll turn green. When you go in, it's red. And when you start clicking, it turn green. Then you go in and you do your charting on, like today's date is what, the 6th patient admitted for this, and they approved, and then that's all you have to write in the chart, and then you on to the next one.
So with that being said, how many patients do you technically see in a shift, maybe?
It can range from like 14 to 15 a day. It depends on how your queue is. They assign you hospitals that you cover. So I cover several hospitals. So if somebody's admitted that day into the hospital, then I would get that.
Okay. And just for that, the entire hospital?
The entire hospital.
Wow.
The entire hospital. You figure how many people is admitted a day. A lot of people are observation, so we don't view those. We just do the concurrent review, patient head in the bed.
Okay, I see now how you break it up, because so you don't do anything with them after discharge, just when they're in the hospital.
Just when they're in the hospital. Once they're discharged, then either most of them either go home and follow up with their primary caregiver, or a lot of times, like I have a hospital where they have a swing bed, which they have a nursing home bed for therapy. And so if they go to like therapy, we'll follow them until they're discharged from therapy.
Okay. Mm-hmm. So what made you look at utilization management and be like, this is where I have to be? This is the type of nurse that I want to do. What drew you to the specialty?
Yeah, when I was working in medical, when I had my first job with medical review for the MAC, for the Medicare Administrative Company, I knew automatically. I was like, yep, this is for me. Sit behind a cubicle. At the time I was sitting behind a cubicle. I wasn't working from home. And I was just like, I was reviewing home health cases. And I'm like, oh my goodness, I love this. Because I was so burnt out on doing patient care, and it matched. I loved it from that point on.
So you were initially in the office and then you transitioned to fully remote?
Yeah, I actually was on a contract. I was on a year contract, and it was actually in the office. And then once I got that experience, I was able to go to a lot of other places. I traveled. I went to North Dakota and worked for another MAC. They had me out there for 5 weeks. They trained me, and then they sent me home with all my equipment, and I worked the entire length of the contract, which was like 5 years. So they sent me, that was my first time working from home. And once I started working from home, I was like, no looking back.
So you've been working from home for a little bit now.
I've been working from home, but I transitioned too, because when I was doing COVID, I would go and I was doing travel and doing case management. I was doing case discharge planning. And so I kind of interchanged the two. It's almost kind of the same thing. When you're in the hospital with case management, you're trying to get people ready to get out the door and, whether they need to go home or to a home health or to a skilled nursing facility. It's kind of the same. That's just on the back end, and then on the front end with the insurance, we follow them also. So it's a nice interchange.
Yeah.
They all mesh
So
together.
you were talking about the training a little bit. What did that look like? Like, what exactly did you have to do for training?
Training, you just have another nurse, a preceptor that'll train you. And that's another thing I wanted to say too, is a lot of people be scared to apply because they don't have the experience. It doesn't matter. Always apply. You're a nurse. Somebody will train you. Every job you go to, they will train you. And so training, like you would
Mm-hmm.
get a preceptor, they'll sit with you, they'll teach you the systems, how to go in the systems, how to chart. So you'll have somebody sit with you for a good at least 4 or 5 weeks before they let you do it on your own. And you
Oh,
always have somebody to refer back to. So the training is really well.
oh,
And they're willing to train. They hire nurses that never done this before and they train them.
oh, that is nice to know because I was gonna
Yeah.
ask you, do you feel like you have to have a certain amount of experience before you apply to a role like this, or do you have to
No,
like start
because
somewhere?
when I first started in utilization review, I did medical review, but I never did utilization review, and so somebody trained me. So
Mm,
it's a lot of people don't apply because they feel like they don't have the experience.
right.
Always apply because somebody, so if they're desperate enough, they'll bring you on and they'll train you.
Yeah, they if yeah, you're right. If a company is looking for people and they're trying to scale and grow at a quick rate, they will bring you on. I do agree with
hmm
that.
And it's a
Now,
lot of contracts. I've been doing mainly for the last, I'll say 6 years. I've been doing a lot of contract work. It's a lot of contracts out there that need utilization review nurses, and a lot of people they'll bring on and like I said, they'll train them. You can do it either contract or you can work through the insurance company. And hospitals have utilization review nurses also.
mm,
Yep.
okay. So when you say contract, are you going through like an agency?
Yep, you go through an agency. Before I started with UHC, I worked for this company called CSI, and I worked for them for a year.
And they got you placed in this role?
Yep, I did it for a year, and then they were like, well, we want to bring you on. Yep,
See,
I worked for them for a year.
okay, okay. So, well, now we're talking about contract work. Let's get into a little bit of the pay, if you don't mind. So,
No, I mean,
how did that differ from when you started to transition into the role? Did you have to take a pay cut initially? Was it the same? Was it a little bit more?
once I transitioned, I did take like a little pay cut. But
Mm-hmm.
but you figure I don't have to buy no gas. I can
I
make my
know that's right.
own lunch.
I know that's
you know,
right.
you don't have to buy no whole new wardrobe.
Mm-mm. You have to pay for parking at the
That's
hospital.
right,
Like
exactly.
it's
So,
like
you take a little pay cut, but in the end, it suffices because you don't have to pay for any of that.
Mhm. So they sent you the equipment, or were you able to have your own at home?
No, they will send you everything. They send you 2 monitors, a laptop. They send you headphones. They also send you the keyboard, mouse. They send you pretty much everything. They send everything.
Now, I know you talked to. Let's talk about the teamwork a little bit with this role. Like, I know sometimes in remote nursing you're a little isolated. Do you feel like this with this position? Do you feel like you still have like that support, that teamwork?
Absolutely. We work through Microsoft Teams.
Yes.
So, we're all on there together. And I always, I ask questions about anything. And I always refer to one of the nurses on my team, the nurse that trained me for the position. Um, I refer to her a lot, and I refer to my supervisor. She's very receptive for questions. And so you can ask anything. It's really a good team, even though you're not seeing each other every day, but going through Microsoft Teams and being able to talk to each other and call each other, it's pretty, I love it. Okay.
Okay, I see
So
a little bit.
the teamwork and the
There we
camaraderie
go.
is really good. Yeah, the teamwork is really good. Everybody, you can approach people, you ask questions, and you know, it's good. You have the support. You have the
Good.
support that you need.
That's nice. And then my next question for you would be, what type of like skills do you really need to do well in this position, would you say?
Well, assessment skills basically.
Mm-hmm.
You need your assessment skills as a nurse. And then you also typing, typing is
Yeah.
a big thing. You have to learn how to type, which is not bad. You get
Yeah.
paid and still do the job, but
Hmm.
just your nursing assessment skills, and a lot, like I said, you go through that Milliman care guidelines. No, you assess it, see if that patient, and most of the time you will know before you even go through MCG that patient meets for inpatient level of care. So, but yeah, so you know, so once you have your nursing assessment skills, I've known a couple of nurses that never even went into like med surg or anything. Some nurses get hired right on to work from home.
Mm.
I've known a
That's
couple of
nice.
nurses like that.
Hmm.
I've known a couple that happened to. But
Good.
long as you have your nursing assessment skills and you're able to apply them, that's pretty much all you need. And to learn how to type and learn how to go through the systems and pretty computer savvy, you'll
Yeah.
be okay. You'll be okay.
Yeah, I agree. Be a very tech savvy or having the IT's number like
Yeah.
right next to
Hmm.
your desk. Like
Right.
that is
Exactly.
important. So on my TikTok, remote RN, like when I'm posting my content about remote nursing, like the number one
Hmm.
thing that comes up is, nurses are worried about losing their nursing skills and things like that. How do you feel about that? What do you think?
You know what? I think that because you see so much come in, you read your patient medical record. So you're learning because you'll learn on a lot of skills, how they process stuff, people, what kind of drugs they're on, what meds, what antibiotics. You're still in a learning process. So even though you're not touching the patient, you're still learning a lot about the
Mhm.
patient, and it's constant learning. So there's nothing you could take away from a nurse doing that. Only thing is you're not actually touching the patient.
Exactly, exactly.
Hmm.
So the nursing degree is still valid no matter where you go, how you
Right.
use it. You still a nurse.
Yes. Yes. Yeah. Yeah. Some people, when you tell them you work from home, they say, "Oh, you're not a nurse anymore." I'm like,
Ex-
"Yes, I'm still a nurse."
I'm very much a nurse. Y'all can look me up on nurses. I have the
Right.
license,
Right.
everything.
Right. Right. And the
Okay.
one thing I did do is I got several licenses. Like I got a California license because
Mm.
California really need a lot of utilization review nurses. They're hiring all the time, contract and permanent positions. So, like I said, people apply. You're a nurse. Long as you got nursing skills and you got your skills up to date, you could do this. You can
Yeah,
do
y'all
this.
better
Yep.
apply because there's so many nurses, when I'm posting my content on TikTok asking me, how many years do I need to transition to remote? How do you get a remote nursing job? This, that, and the third. And if you didn't know about utilization management, now you do.
Right. And I have to tell a lot of people too, like when you go on Indeed or those job search,
Hmm.
always put in utilization review and don't put the state, put remote, and it'll bring up all those
Mm.
positions. Also on LinkedIn, just put utilization review and then put remote, or don't put nothing for the state, and it'll bring up all those jobs. But it's a lot of contract positions out there. I have like I had like 4 people call me last week saying that, they needed nurses to do utilization review. So
See,
it's a
and
lot out there.
we have to talk after this.
Okay.
Yeah,
That'll be
because my
good.
staffing agency, we're looking to get some contracts here.
Yeah. Get
Let's
some
see.
contracts.
What do you consider to be the most rewarding part about working remotely as a nurse or doing utilization management?
Like I said, you constantly learning. It's always different stuff. And that's what I love about it. Just putting being able to still put my skills to work, even as a remote nurse,
Mm-hmm.
and I live in Wisconsin, so it's kind of cold and snowy, and I don't have to deal with that.
I know that's right. I know that's
Yep.
right.
Yep. I love working from home. I do.
Yes, it is
Yeah,
very
but the
nice.
one thing I do to keep it all in check is that you do have to leave the house. You do
You,
whether you go to the grocery store, you have to get some fresh air.
yes.
You have
Yeah.
to leave the house.
Yeah, we do have to leave the house. And that goes into the next question. How do you maintain a healthy work life balance while working remotely as a nurse?
Right. And you could get caught up working all day and all night. When
Mm-hmm.
my shift is over, I shut down.
Mm-hmm.
I don't stay over, unless I'm asked to stay over or to work overtime, which is rarely ever. But I work-life balance when I'm at home. When I'm off, I'm off. I don't touch the computer again until it's time to go to work.
I know that's
So, yeah.
right. I know that's right.
And get out the house.
Andrea, y'all hear her. Get out the
Get
house.
out the house. Oh, you'll go crazy.
Okay. All right. Let's go ahead and try to wrap it up here. What advice would you offer to nurses considering to transition into utilization management? We touched on this a little bit, but
just take your time. Don't get frustrated. It's a lot to learn. And being a good utilization review nurse, it's going to take you about a year before you get all of your, skills up to par. Don't give up. Continue to try to apply for those jobs if that's something that you want to do. Somebody will hire you, and just give yourself time to learn. It's a big transition from coming to the floor to being, a lot of people can't work from home. A lot of people don't like being by themselves, or just not being around other people. You have to give yourself time to adjust to being a remote nurse.
All right, Andrea, can you let nurses know where they can find you if they want to learn more or try to link up? And you guys
sure. You could reach me. You can reach me by Facebook. It's Andrea A. Brown. Or if you really want to talk, you can inbox me, or you can call me 414-839-7564. And I don't mind helping anybody learn how to do it. Yep, you can always call me.
Oh, thank you, Andrea.
And I will help you. I've helped people with their resumes too and helped them get jobs. So I kind of.
Y'all hear that?
Yep, I kind of help put their resume together and show them how to piece it together to, to get them hired.
Yes, Andrea. Yes, we love to see nurses helping nurses.
Each one teach one. A lot of nurses are like that. Each one teach one. That's how I feel about it.
And that's how you grow the community. That's how you give back. That's how you do all of that.
Yes.
My name is Ava. I'm the Chief Executive and founder of the Remote Nurse Staffing Agency. I will put more information about the agency below, NursiConnect.com. I'll also put Andrea's information below too, like her Facebook. I'll add her phone number in the show notes. Again, I'm the owner of the Remote Nurse Staffing Agency, NursiConnect. We're looking to place inpatient virtual nurses, psychiatric nurse practitioners, and remote nurse case managers. So if you are interested in that, please submit a resume to NursiConnect.com. Andrea, thank you so much for being on the show.
Oh, you're so welcome.
Next one. Bye, y'all.
All right. Take care. Thank you.